This webinar is this webinar is being conducted in English. Interpretation is available in French, Amharic, and sign language. Please click on the globe icon to select the language for your preference. For English, click English. For French, click French. For Amharic, you can click Amharic. The webinar will be recorded for sharing externally, as I have mentioned. Before we begin, I would like to let you know that please keep your microphone muted unless you are on speak, and you are welcome to use the chat for reflection or other question throughout the session. We will have a dedicated question and answer segment toward the end of this webinar. So thank you all for joining us. As others join, I want to speak briefly about this program. The Girl Generation Support to Africa-led movement to End FGM program, we call it the short TGG-ALM, is implemented by a consortium led by Options Consultancy Service, which include Amref Health Africa, ActionAid, Orchid Project, and the Africa Coordination Center for Abandonment of FGM, ACAF. The program also works closely with the Population Councils Data Hub that handle the program data and measurement. Our vision is a world where girls and women can exercise their power and right, have expanded choice and agency, and be free from all form of violence, including FGM. Our program work is underpinned on the do not harm principle, ensuring that survivors, champion, and communities we work are in safeguard. As such, I want to highlight that the just ended 60 days of activism. As you all know, we just ended 60 days of activism movement to end violence against women last week. Team centered on in digital violence against all women and girls. May we all continue to advocate for the end to all form of GBV, including the digital violence in our work. The girl generation recognize female genital mutilation as a form of violence against women and girls and violence of their human rights. We don't consider this as a norm, it's a violence of women's and girls' rights. This is therefore to remind us the conversation around FGM may to be triggered especially for survivors, and therefore we urge all participants to engage with care, respect, empathy, and if any point you feel overwhelmed, please feel free to take a break. Your well-beingness is our priority. As mentioned, this session will be recorded and shared afterward through our YouTube and other social platforms. A reminder that this webinar will be conducted in English. Interpretation is available in French, Amharic, and sign language. Please click on the globe icon to select the language you prefer. For French, click French. For Amharic, click Amharic. So as I have mentioned, the topic of the webinar is combating FGM in conflict zone of Ethiopia, Somaliland. We will share a lesson and approach from the Girl Generation ALM program, and we will focus on the evidence from Somaliland and Ethiopia to examine how the conflict shape community responses to female genital mutilation and affect the ability programs to support abandonment. It will explore what happened to social norms, service access, and community-led action when instability disrupts everyday life in identifying the adoption that enable local actors to continue protecting girls and sustaining awareness despite insecurity. So we have speakers from both countries. Our speaker will share a lesson from implementing FGM intervention in this violating environments. It's hoped that this insight will guide future efforts to end FGM in crisis setting, highlighting opportunities, challenge, and lesson learned. So my name is Magdalena Iskerman. I am Advocacy Officer for ActionAid, and I will moderate this webinar. Our speakers today are Gannet Shume, Head of Program Action Aid Ethiopia, Salamwait Adeno, Women's Rights Manager. She's also from Action Aid Ethiopia, and Hibo Elmi, Program Manager from Action Aid International Somaliland. We are also joined by Chinwe Masano, Program Quality and Assurance Manager from Action Aid UK. So without further ado, allow me to take this opportunity to introduce our first speaker for today, to give us an opening remark. Gannet Shume. Gannet is a dedicated advocate for gender equality, women's rights, and social justice. With this experience to her role as head of program at Action Aid Ethiopia, she has collaborated with a diverse range of stakeholders, including human rights actor, policymaker, community representative, and government agencies. Gannet will give us an overview of implementation of the TGG-ALM program in Ethiopia. Over to you, Gani.
Good afternoon, good morning, or good evening, everyone. It's an honor to give an opening remark to this. It's my pleasure to share some of the program that we've been implementing in ActionAid Ethiopia as part of the Africa-led movement in the female genital mutilation in Ethiopia. I would like to recognize the contribution, technical and financial, from FCDO that enables us to really do an amazing work in this regard in Ethiopia. And also, I would like to commend the collaboration and the coordination of options consultancy services for us to strive through this past few years to do very successful programming in the conflict contexts in Ethiopia and beyond. As a federation, ActionAid as community mobilizer organization, we've brought lots of experiences as well. We've taken huge lessons from implementing this program. So I really want to acknowledge that we're part of this journey to end female genital mutilation, which is highlighted as human rights violence, particularly women's and girls' rights violations. And I would like to thank everyone who has dedicated their time to this learning webinar, which I believe you would make most of it going forward to design similar kind of implementations and beyond. In Ethiopia, the Girl Generation ALM FGM program has been implementing in 2 districts in subnational region called Amhara region, where we have mobilized diverse actors, but centering or focusing on the program as girl-led and community-based. So this intervention, which we started since 2022, April, has ignited lots of movements against female genital mutilation, gender inequality in general, in the program specific districts, but also beyond to the regional and federal level initiatives. ActionAid, through the ecological model of this program, we have been able to reach and change behaviors at individual level, household level, structural and systemic level, which brings a holistic kind of or transformative kind of
Is it only me or we have lost Gani?
and with more than 85 ethnicities and diverse culture and societies. In this regard, FGM stands at 65% of practice across the nation, with diverse range from 24% at some communities to close to universal type of or magnitude of practice in some parts of the country. With this diverse program, diverse magnitude of the practice and human rights violation, we are targeting these specific communities where the practice stands at 61%, and we believe through this program we have brought lots of attitude, behavior, and practice change. In this regard, our country, as part of the SDG 5 commitment towards gender equality, Ethiopia's government make the commitment to end FGM by 2030. And towards this, our government made the commitment where it established national alliance, where it brought diverse actors together for collaboration, accountability, and comprehensive programming towards ending FGM, one. And second, our government has also set a clear and costed roadmap to end FGM by 2025 this year. So the 5 years have come to an end, and this national alliance is doing the inline evaluation to see where FGM stands now, and we anticipate another 5 years until 2030 would come on board very soon as we start the coming year. So we commend this all initiatives of our government, and we, Action Aid Ethiopia, has been part of this national alliance movement to end FGM, where the girl generation movement to end FGM has been contributing a lot to this national level engagement and initiative, where we have been able to link the lessons, the learnings from this specific level of intervention to national level learning spaces and policy advocacy programs. Saying this, I wanted to highlight that as we started the ALM, the TGG-ALM program implementation, a remarkable incident happened in Ethiopia in general, and particularly in the program area where we have been implementing the TGG-ALM program. That conflict erupted just about a year since we started the program. So having this context in our operation areas, we have been resilient and the communities as well have been resilient to push the program implementation and achieve its mission and goal to see women and girls having power in their hands to say no to any violence and rights violation, and to build their agencies. So this conflict has impacted us in a very different way, that schools have closed out for long, that we were challenged to do school-based interventions. Movements have been restricted, and mass campaigns have been restricted or limited, and we've been forced to operate in a state of for more than or close to 3 years since we started the program. So finally, I wanted to highlight that in spite of all these challenges, the program, the communities that trusted us to join us through this journey have been with us and stayed resilient and persistent in challenging FGM practices and mobilizing many allies to end FGM in the communities and contribute to the national level advocacy work that we are doing, where community representatives provides testimonies and committed to end FGM throughout the program areas where such conflict has continued still. So I wanted your all your attentions so that you would benefit from these experiences of programming in conflict areas, the pros, cons, and the benefits, and the tactics and approach that enable us to, do or deliver as we committed and ensure our goal is met at the end. So I appreciate that the program has stayed adaptive to these changes and contexts and community, needs as part of its delivery. Thank you for your attention to the matter and for joining us to this learning webinar. Thank you again.
Thanks a lot, Gani, for providing those important remarks. I will now proceed to our second speaker, which is Salamwait Adino from Action Aid Ethiopia, Women's Rights Manager. Salamwait is a seasoned Women's Rights Program Manager at Action Aid Ethiopia, with over 13 years of experience in advancing gender equality and women's empowerment. Her expertise include leading programs focused on gender-based violence, prevention and response, and also women economic empowerment. Over to you, Salam. Salam will share the experience from Action Aid Ethiopia side. The floor is yours, Salam.
Thank you so much, Makli. Hello, everyone. Thanks a lot, everyone, and welcome to this learning webinar. So I'll be presenting, this is a joint exercise, as you all know. We did this joint learning brief with Somaliland. So I'll be presenting the part from the side of Ethiopia. I hope you can all see my screen. Can you see my screen? Please confirm. Great, thank you. So I believe most of you are from the TGG-ALM FGM program. So just to give you a background on the program implementation in Ethiopia, we started implementation in April 2022. As you all know, the program has 6 major outputs towards the program outcome. Our interventions had focused on community implementation, integration, strategic media and communication, as well as evidence and learning. So coming to the context in Ethiopia, the national data on FGM prevalence, as Gani mentioned, is at 65%, according to the Ethiopian Demographic and Health Survey from 2016. Our program in Ethiopia focused in Amhara region, despite the other higher rates in other regions, which have percentages even above 90%. This is because we chose Amhara region basically because we had based there. We are based there, and in terms of absolute number, due to the higher population number in Amhara and Oromia region, the Amhara region prevalence is of course at 61%. But because it's the second more populous region in Ethiopia, the absolute number is the highest. And our implementation focused on in South Gondar zone into waradas or districts, as FGM and child marriage were highly prevalent. Okay. My slide moving, I'm not sure. Is my slide moving on your side?
No, it's It's not. Do you want to try again?
Yes, let me try. Let me stop sharing for a while. Can you see it now? Okay.
Yes,
So
we can.
thank you. So, as I mentioned, the program started in 2022 April, and the conflict in Amhara region started in 2023, which made it very difficult because a state of emergency was declared by the government, which lasted for 2 years, and that curtailed the right to association, to meeting. Schools were closed, road transport was closed, there were killings, kidnapping, which worsened the conditions for women and girls. There was conflict-induced economic hardship, which also increased the prevalence of child marriage and FGM. And there was also protection vacuums because the social workers, community educators had to also migrate to protect themselves, leaving behind the girls and women who needed the support. There was limited access, there was safety risks and shifting priorities as a result of the conflict that erupted. So for doing this learning brief, the data and evaluation methodology used were qualitative, focus group discussions and key informant interviews were conducted in the conflict affected districts. And for this purposive sampling was used to ensure the representation from the diverse groups. So in the case of Ethiopia, the 6 focus group discussions were held in both Guna and Farta waradas. As you can see, there were 16 men, 18 women, boys and girls were also represented in this. And 8 key informant interviews were also conducted with health extension workers, teachers, religious leaders, facilitators, and all program stakeholders. So going straight to the findings, we've seen that conflict disrupts social life. It's not just a single event, but a collapse of the functioning of the system. Some of the quotes, as you can say, they said that leaving home and moving freely had become risky because no one knows when fighting would break out. There were incidences where armed groups were frequently coming to households demanding for food supplies. And so much of the system was not functional. It was seen that social cohesion had weakened because of fear. People did not come out to conduct both economic activities and also social interactions. The youth were particularly suffering because both the government as well as the armed groups were targeting them and requesting them and questioning them, interrogating them to which groups they belong and things like that. The other major finding from this assessment was that the knowledge on FGM had different implications. Sibo will speak on the aspect or the findings on Somaliland in Ethiopia, because we started in 2022 and foundational works were done to raise the awareness of the community. The respondents said that recognized that FGM is a violation of human rights and it harmed girls and women gravely. So because of the conflict, there was no change that that came out on the attitudes of the communities. Okay, I see someone has raised their hand. Is it because you can't hear me or? So,
but if it's a question, we will have a session for that later. So continue. Yeah.
Thank you, Magdi. So the Ethiopian participants, they said the awareness remained strong, and they understand that FGM harms their daughters even during the conflict. So seeing the drivers of FGM, the drivers are the long-standing cultural norms and expectations. It's about honor, marriageability, and the purity of the girls. And as you can see in the quotes, it says that if a girl has not undergone FGM, they believe that she may not be able to get married, give birth. She may not adapt to her husband, get used to her husband. And there's also a belief that she cannot be the wife of a priest. If a girl has not undergone, they believe that she would have a strong sexual desire and would be going to multiple sexual partners. And they also associated FGM with being a good wife, as it's believed that FGM would make it more convenient for intercourse. So going to the conflict, the direct effect of conflict on FGM, we realized that in the context of Ethiopia, it did not have direct implication on community attitudes, because they noted that they still believe that FGM harms girls. However, because it's so much associated with social norms, it's been found that FGM practice has been continued somehow in secret. The practice has been because of the restrictions, because monitoring systems were undermined. There were incidences of conducting FGM in secret. Health workers, although they were the major actors during the time of conflict to reach out to women as their duty requires going to households, they still said that the pressure may be higher for the families to extended families to enforce this or to encourage them to undergo FGM. So the major analytic reflection is that conflict undermines the systems, not necessarily the attitudes. So they're largely rejecting FGM because of the awareness before the conflict arose. The weakened structures, however, we're seeing that because of the weakened structures, there were hidden practices happening here and there during the conflict time. The conflict also contributed to disruption of essential services and anti-FGM programming. As I mentioned earlier, because of the state of emergency, we could not do business as usual because most of our interventions were focused on having the conversations at schools, at community level. The people and the women, girls, the religious leaders and community members that we work with, we had to meet them frequently. Regular meetings were held for a structured dialogue with them, but because of the conflict, this was not possible. So this was one area that needed adaptation. Because movements were dangerous, gatherings were not possible, there had to be a way to adapt so that we could do it in a safer way. A woman in Guna said that it's difficult to reach and gather the community because the armed groups, actually both actors would think that it's a political gathering, and they would think that that would not be necessary. But they had to show the training materials, they had to converse with them and tell them what the objectives of the program are and why they are holding the meetings and things like that. The other thing is that school closures significantly affected the program. As I mentioned, the structured peer discussion at school levels with girls and boys was one of the major interventions that got disrupted. Students were not able to come to schools because it was not safe for them to travel. So this was also another area where we had to adapt. to holding the discussions outside of the school. The extension workers also said that movement was restricted, so it was easier for them, as Hiba will speak to you shortly. It was restricted, but it was easier for them to move around and still reach out to the communities. Of course, access varied across the qabalis. Some of the qabalis, the nearer ones, and depending on where the armed groups are placed, access was also, it varied. Some of the qabalis were accessible, some were inaccessible during this time. The other thing that the conflict affected was the other services, the public services, like education, health, and especially psychosocial services were severely reduced, which heightened the risk for women and girls. The women reported that even ambulance services were discontinued. The armed groups were stopping them from going to the hospitals. So the health and the education services were highly impacted, and it was also reported that 2 schools were totally destroyed due to this, due to the conflict. So coming to the adaptations to mitigate the impacts, Hibo, is this where you come in?
Thank you, Salamawet, for your presentation on the findings.
Thank you, Hibo. Maybe before proceeding to Hibo, I would like to give a reminder for our participants. If they have any question, they can drop in a chat box in the Q&A section. And also people who have joined, let's keep introducing yourself in a chat box. And there is interpretation service in French and Amharic. Please go to the globe mark. Interpretation is for Amharic. Select Amharic, and for French, select French. Over to you, Hibo.
Thank you, Magdalawet. So I'll run through the adaptations and mitigations from the report that we have done, and then I'll go back and share some of the findings from the Somaliland part as well. Salamawet, if you could move, go to the next slide, or I'll share it from my side if that works for you as well.
I think that's fine, Hibo. You can share.
Okay, thank you. Please let me know when you guys can see my screen.
We can see it, Hibo. You can put it on presentation mode.
Okay. Okay, so I'll read through. Wait, let me remove this. Okay, so I'll go through the adaptations and mitigations that both countries, when it comes to the challenges on the conflicts that has been impacting the program during the years that the ALM has been operating on both countries. So despite the challenges, respondents in both settings describing adaptation strategies that allow some activities to continue, community initiatives within Kebal help cascade FGMC messages even when free movement is difficult, relying on religious leaders and youth groups and women groups and volunteers, facilitators. Those would be the team that both countries have worked with, trained, and gave advocacy lessons as well as tools to continue the work on the ground. Healthcare workers integrated FGMC messaging into routine maternal and child health visits, noting that pregnant mothers attending services, as one of them has shared learnings about FGMC alongside other health packages. Program design acknowledged that fragmentations and including flexible outreach methods, community actors such as the women groups, and I think we have already shared this point, but those on the ground, especially women and youth and religious leaders and volunteers, were the vital when it comes to formal systems, emphasizing the importance of investing in local leadership in advance. And at program level, adaptations and safety strategies, continuation of activities depending on decentralized, hyper-local, and safety-conscious delivery models led by embedded community members rather than external teams. So focusing on those who are on the ground to help us deliver the activities on the ground and being able to do it safely as well, them being already embedded within the communities that they're working with. Health extension workers integrated FGMC messages into routine maternal and child health visits, newborn follow-ups, and vaccination schedules, activities that could continue even when larger gatherings were unsafe, gatherings which will put communities at risk, as well as those who are delivering awarenesses. Women, particularly health extension workers, women watch groups, and women and voluntary community facilitators were often more able to move without attracting suspicions than being a part of the community, even though they still face significant protection risks during the conflicts, in which sometimes movements were restricted beyond sometimes. And then women could continue household visits, small group discussions, door-to-door discussions, a follow-up of newborn girls, while men risked integrations or violence. This made women indispensable to maintaining program continuity. So women being able to move around were a vital part of spreading awarenesses during the conflict situations. Rescheduling meetings at short notice, shifting to safer locations, and engaging religious leaders to legitimate discussions and reduce suspicions from armed actors. Facilitators and teachers used phone calls to supervise activities and coordinate with volunteers, follow-ups on cases, and maintaining contacts when movement was unsafe. Permissions from local armed actors sought before meetings. This was to safeguard those who are on the ground, and gathering discreetly outdoors when tensions were high, and shortened sessions if movement is becomes risky. So analytical reflections from the lessons that we have learned so far was scheduling meetings at short notices and shifting to safer locations to engage religious leaders. Okay, I think I've already went through this part. So evidence shows that anti-FGMC programming remains possible during conflicts as well. And the lessons that we have learned during those years was that local champions expand their roles during conflicts, often beyond what program is originally envisioned for them, as well as religious leaders holding a unique Catholic power in both contexts though for different reasons. Adaptation is hyper local, creative, and shaped by gender safety dynamics. So those were the lessons that we have made, as well as the adaptations in both of the countries for us to be able to spread the awareness of FGMC with local communities, with the conflict situations that both countries has faced during the program years that we have been implementing. Over to you, Magdalena.
Thanks a lot, Ivo, and we thank you all the speakers for giving us a context and sharing the finding from your assessment. So now let's turn our attention to the comment section and the Q&A. Jacob here will take us through the comment and the question, and he will now read some comments and post selected question to the speaker. Jacob, over to you for taking us through the questions.
Thank you so much, McD. It's good to see these conversations flowing very well. On the chat box, people just interacting and sharing their names and where they're calling from. It's good to see that this is well spread out. So in terms of questions, and please, ladies and gentlemen, feel free to utilize the chat box to drop a question, a comment, a thought towards the conversation that is happening. So there's one question from Ernest Clement Mendy, and they're asking, in situation of armed crisis or insecurity, where violence-based issues tend to overshadow social norms, related concerns, what communication strategies have you used to position FGM preventions as a priority to save girls' lives? I'm going to read that question again. In situation of armed crisis or insecurity, where violence-based issues tend to overshadow social norms-related concerns, what communication strategies have you used to position FGM preventions as a priority to save girls' lives? I'm not sure who wants to take that up. Anyone wants to take that up among the panelists?
Can I come in, Jacob?
Please, Salamwit.
Thanks, Jacob, and thanks for that very important question. Was it Ernest? Yeah. As he has rightly mentioned, in times of armed conflict, there are more pressing priorities: security, safety. People need food because they were not. Their movement was curtailed. They could not move around as they needed to. So you would see in the report that came out that prevailing priorities were a challenge. But what helped us in the context of Ethiopia is, as I mentioned, because we started the program a year earlier, and we had worked with the local community structures like the Women Watch groups, the local government, and women groups. We were able to lay the foundation for a referral package, referral system that could be helpful. Of course, we did not anticipate that conflict would erupt in our second year of program implementation, but that foundation had really helped us to sustain our efforts, sustain the conversations that were started in a safe way without compromising the safety and without further doing harm. So yes, we acknowledge that there are other priorities that come in the context of conflict, but this is what helped us adapt and continue the conversation and the interventions on ending FGM. I hope that I've addressed. Thanks.
Thank you so much. And just a follow-up to that, Joanne is asking, to what extent were the community still interested in discussing FGM during conflict when they were dealing with a lot of these other challenges? Did you have to integrate FGM into any other related topics to make it still more relevant? Or how did you guys go about it?
Can I jump in on that second one?
Yes.
Thank
Yes,
you,
Hibo.
Salamwit, for covering on the first question. That's a really important question, from Joe, especially if I talk a bit about the context here in Somaliland, in which for the past few years, we have been also dealing with severe drought. So you could understand how integrating FGMC works, especially with locations in which conflicts and the resources are really limited. It becomes a very challenging. But what's coming out from the communities, especially from the report, is what we have seen is they shared that there is a decline during the conflict as well as from the families, because they're not focusing on survival. They're more focused on survival than ceremonies. Normally, they do ceremonies here in Somaliland, especially on those eastern regions when they're circumcising their young girls. So just you could imagine when their security is compromised, and then there are severe droughts in which they are dealing with. So they shared with us that they're trying to survive. So in way of us trying to also find to integrate another programs into FGM was the part of we had other programs, especially on emergency and humanitarian running, and we were kind of integrating that into it. And then the issue comes on with the aid cuts as well. So now with the aid cuts, we are also impacted by it. So now we don't have access to the same programs that were operating in the same locations. And now you have conflict in which families are trying to be safe, and you are trying to find situations in which you could bring out those communities so that they could listen and learn and take awarenesses from the impact of FGMC. So when integrating FGM into situations in which conflicts are existing from the communities, the studies that we have used was making use of local actors, making use of those who are already on the ground, making use of the youth and the religious leaders and the people that they would be more interested to listen to messages coming from them. And sometimes we made use of the Friday congregations so that they will be able to listen to the lessons that scholars are sharing from the mosques where they are there in their own homes. We did that actually works with them so that they'll be able to do the door-to-door sessions so that we are not bringing out a large number of community members into a gathering and having them being part of having them met with any sort of insecurity. So a door-to-door session is doing it in which women and young girls are able to do when they do their own gatherings on Fridays or on the weekends when they meet, or either on the markets when they are meeting as well. So kind of all of, in a nutshell, it is us training and working with local community change agents that could deliver on behalf of us, and that they will be able to do it in a way that they are also, because they are the ones that are on the ground and understand the situation that their community in, and the way that they're delivering it to them is in a setting that they understand their community will be able to listen to them and take note of what is being shared to them. But as it's a burden for all of us in context of conflict, if we don't have integrated programs such as livelihood or education or health and wash, it becomes a bit challenging just to do an awareness programs, especially on FGMC, in a context which drought exists as well. Thank you. Over to you, Jacob.
Thank you very much. Is there any, probably we have like a minute or so, and I stand to be guided. Is there anyone that has a burning question that they might want to just raise that they haven't raised on the chat box or the Q&A box? You could raise your hand and we can give you an opportunity to ask. Anyone?
There is a hand.
Is there a hand?
Nabiha. Yes,
Nabia,
Nabiha.
please
Yeah.
go ahead. Please, Nabia, go ahead.
I've been raising my hand for a
So
long
sorry.
time. I get tired of raising the things that make possible to continue mitigating FGM practices in the community during the crisis. First, let me introduce myself. I'm Nabiha Amar from Nefs Network, which is
Hello
a
everyone.
partner
Is my voice
in
audible?
the Sorry,
Yes, you are. Yeah.
am I clear? Yeah. I'm from Nefs Network, which is the network that leads End FGM in Somaliland. We are also a partner in the TGG program and in Somaliland. And things that make easy to continue awareness raising during the crisis, because the area in Somaliland that this program works are Sool and Sanaag, which is the mainly most conflict area, and during the implementation, in particular in the year ended 2024 to 2025, these regions experience and conflict crisis and also in drought crisis. The thing that make it easy is that we use flexible scheduling From time to time, we've been updating the schedule of implementation of activities in close consultations with the line ministers, local authorities, community, themselves. They constantly consult us when it's possible to conduct certain kind of activities and when not to conduct. And sometimes we end up having sessions in the afternoon because they recommend that women are mainly available at the afternoon because they are more busy in the morning times because of their house chores and other responsibilities. So having a flexible schedule with the consultations of the community and the local authorities really help us to continue and having sessions during this crisis. The other thing is that we use the existing community structures like community committees, existing volunteers, health workers, those who exist within the community. They help during in the time of the conflict when the community move from place to place. They move with the community and they keep doing the door-to-door awareness. They keep doing reporting when in FGM cases may occur. They also raise awarenesses within the community during the seasons that FGM is highly practiced, which is when the schools are off. So utilizing the existing structures within the community helps community-led change and ownership and also sustaining the change. It may not be big and but as they are within the community, they make it sustainable and it keeps moving with the community. And also being a network that has been leading the effort in ending FGM in Somaliland in last 15 years, we learned that in FGM needs to be integrated with the other programs. Sometimes as you yourself, sometimes you might feel that when people are struggling with their life because of the drugs or other conflict crisis, you feel like, how can I do this while the people are struggling to live and to survive? So integrating it with other programs really helps to have, better outcomes. And for all our programs, we integrate an approach called SHE approach, which we been implementing in Somalia since 2013, which is a community-led driven that empowers women to improve their lives, their community lives, and advocate for their rights by themselves. It enables women to be independent, and in Sool and Sanaag also, which this program works, they exist. So this structures also enable us to continue the efforts, and they also help us with resource mobilizations as they with their deposits that they do for contributing to their community development. They have contributed to organizing such meetings within the community, which they provided the resources like the venue, the space, and other consumable things that are so integrated with other programs also helps to continue community-driven changes within the community. The other thing is that, the TGG program approach is bottom-up approach where we in the approach works with the small structures or small organizations that exist within the community. When in our context, when you are dealing with someone from your community or organization that exists within your region, and when the organizations comes from other regions, it makes it different in our context. So in each location, the organizations that have been implemented the program were within the community, so they feel like they feel ownership, they feel trust, and the relationship between the community and the implementing partners improve, which make things easy for us and for other implementers to implement and continue efforts. Thank you very much, and over to you.
Thank you, Nabiha. Fatima, your hand is up as well. Do you want to step in?
Hello everyone. I hope if my voice is audible, please you can tell me. Is my voice
It's
audible?
well. Yeah. Yes, you are.
Can I continue?
Yes, please proceed.
Hello
Fatima,
everyone. Can I
yes.
continue?
Okay. Yes, please continue. Continue. I don't think we can hear you, Fatima. You are on mute in case you are speaking. Yes, your voice was audible, but now, yes, you are unmuted. Please continue. We still can't hear you. Okay. So you could also drop it in the chat. Thank you. You could also just drop it in the chat and
Okay.
then,
Thank you so much. My name is Fatima Mohammed, and I'm
okay.
from Ethiopia. I have one question to the panels, and it's both. I will be asking the question as a woman, as a youth, and also as a survivor from the FGM. And my question is, especially for the panel from Somaliland and also the panel from Ethiopia, especially the eastern part of the country, the Somali region, the FGM practice. We know it's a harmful practice, but the Somali communities have been doing it for a long period of time, and combating it in the community is taking a lot of activities and it's taking a lot of time, and it might be because the community has normalized it doing it. So now many organizations, many NGOs, and also INGOs have been taking different activities to combat it. So, and now my question is, what are the roles of the government, both from the Ethiopian side and also from the Somaliland side, sorry. So what are the roles of this government in combating the FGM, especially when the communities are not willing to comply the policies and also the strategies that the government have been developing to stop this harmful practice, and especially when it comes to the when it comes for those girls in active conflict zone, because it is a double challenge. First, these activities have been ongoing for a long period of time, and now the conflict, also the climate shocks. So all this. So I just want to know what is the role of these governments are doing, especially when these communities are not willing to comply or to follow. So, and what consequences are there? Thank you so much.
Thank you so much, Fatima. And also just from John, John is saying that I just wanted to say how impressive it is to hear about the tenacity and creativity of those continuing this work in such a challenging context. So very inspiring, and kudos to all of us. Yeah, I can't see any other comment. So please allow me to take it back to MacD. Over to you.
Thanks a lot, Jake, for handling a comments and a question and answer section. At this point, allow me to invite you all to take a post-webinar poll, which will have 4 questions. Viola, can you please share the screen of the poll? Yeah. I hope everybody's seeing this. Please let us hear your feedback on the webinar. You can also provide any additional feedback or suggestion on this webinar on the chat box. I can see that in the chat box, people are networking. Thanks for your participation, comments, and feedbacks. If we are all done with the poll question, allow me to inform you that we have several publications on the Girls' Generation website. If you look at our resource section, you'll find, yeah. So I'm seeing that most people find today's webinar useful. Thanks for your feedbacks. Thank you. Also, you can look to our resource section. We also have a guideline for engaging survivors of FGM, their safety and respectively in programming and advocacy work. We also have a tool that a Girls Center, which will guide work with use in school, FGM manual for school-based intervention in Somaliland. So you also can find practical resources to support your works in ending FGM. So please visit our website and resources. We will share some of our link here in a chat box. Go through it. Having said this, I want to invite Chimiwe Masano to give a concluding remarks. Over to you, Chim.
Thank you so much, Migrawit, for moderating this event today, and also to our panelists, Kenneth, Selam, and also Hibo, for sharing your experiences for the 2 countries. My name is Chimwemwe. I am the Program Quality and Assurance Manager from ActionAid UK, coordinating the project from the AUK point of view. However, I'll not take much of your time this afternoon because we have listened quite a lot from the 2 panelists who have shared a lot, including Kenneth with the overview on what is happening in Ethiopia and also Somaliland. And we can see that most of what we have listened today or heard today, it points to a sustainable progress where ending FGM is depending on the strength of the community and also the local systems that they've built along the way. And also, we have seen that much of the work also was hinged upon the adaptation of the delivery of the program. And this made it possible because we had the backing or the help and also the support that came in from our options team and also FCDO
allowing us to adapt to the various contexts that we've been working on. So this meant that when we had the conflict that we are now at heightened level, we made sure that the program adapted to how we were now implementing in the communities. With that being said, all along from the onset of the conflict, the program team also facilitated the processes using online made it possible for them to also coordinate with the teams on ground and made sure that whenever there was a heightened risk, they also evaluated and talked to the communities to make sure that everyone else was safe. And when it was not possible, they coordinated with also the government stakeholders so that in as much as we wanted to make sure that we go on with the implementation of the project amidst the conflict, the welfare and well-being of the communities was put as a first priority. So thank you everyone for coming in this afternoon to listen and also learn from our experiences from the two countries. So if you find that you wanted to work with us in the near future, please do contact us in the ALM website, as Migdarit has pointed out, to find out more about our work and the resources that are there. So thank you so much for joining. Over to you, Migdarit.
Thanks a lot, Shinube, and for joining us and for your active participation. Please follow us on our social media platforms. We are on X, Facebook, Instagram, LinkedIn, and TikTok. And also visit our website at www.theguardgeneration.org. We will share the links here. We also have a YouTube channel. Thank you again for joining us. Look out for more information on our socials, and we will send invites through emails. Thank you and goodbye. See you next time. If you are comfortable, please open your video and let's do a farewell.
Thank you so much, Migdarit.
Thank you.
Bye.
Bye.